It's only a swab of the gums.
Do I turn it and do the bottom?
It takes only 10 seconds. It could save a life, prevent passing on an infection. It could stem an HIV epidemic
Thank you.
in the African American community. But stigma gets in the way. African Americans make up 12% of the U.S. population, but account for 44% of new HIV cases, according to the U.S. Centers for Disease Control and Prevention. There are many reasons, among them lack of information and access to health care, but stigma causes people to be afraid of learning whether they are HIV positive. Timothy Harrison is with the Department of Health and Human Services.
We all believe it's a huge part of what is deterring people from getting tested, and if they test positive, it may deter them from being linked to care or staying in care.
National HIV Testing Day confronts the stigma. At this year's event in Washington, people lined up on a sweltering day to learn their status.
And that's important. And that's an important piece because if you know your HIV status, you are more likely to take care of yourself and you're least likely to transmit the virus to somebody else.
We believe that addressing stigma and discrimination is essential.
This conference at Howard University, a historically African American college, addressed the issue of the stigma of HIV. Dr. Sohail Rana has seen patients die because of stigma.
From the time you attach stigma to any illness, you make its outcome like 300% worse.
Civil rights organizations and African American churches led the movement for equality in the 1960s, but they were slow to join the movement against HIV/AIDS in the African American community. Now that's changing. Siobhan Arline Bradley directs health programs at the NAACP, the oldest civil rights organization in the U.S.
So what we decided to do was to identify what messages resonate with parents, what messages resonate with faith leaders. And the message is this: there are people dying and you should care. Lives are being lost. You have to care.
U.S. health agencies are working to get out the information that HIV is preventable, that testing is essential, and that HIV is not a death sentence. The website AIDS.gov says unless the course of the epidemic changes, at some point in their lifetime, an estimated 1 in 16 black men and 1 in 32 black women will be diagnosed with HIV infection. These rates are at least 8 times higher than those for whites. Carol Pearson, VOA News.